All right, everybody, I have the top of the hour and we have lots to go over today. So I'm excited to go ahead and get started. You're all automatically muted. This is being recorded. So after the session today, you'll get a recording, you'll get a PDF of the slides, a bunch of other links that I'll talk about today. So don't worry about having to write down links or anything like that. I will send them via email. Feel free to enter the chat, your organization, where you're from, what county, bonus points if you tell me the weather today. And then the other housekeeping item I wanted to share was I'll turn my camera off for the majority of this. I'll turn it back on at the end. It just helps, I feel like, with distractions and broadband and everything like that. So feel free to ask questions as I go, either in the chat or the Q&A function, which you all have access to. And that way you don't forget your question. There's chances that your question will get answered as I go through, but at least this way you don't forget it. And then I'll be on after to answer any questions that you guys have. So with that, we're going to go ahead and get started. We do have a full house today. Like I said, you're automatically muted. So raise your hand or put something in the chat as we go if you have questions, and we'll go from there. So first, a very big thank you to the Kansas Department of Health and Environment, Kansas Maternal and Child Health. It is because of a partnership with them that we are in Kansas. So actually, I'm based in Iowa. Our organization is based in Iowa, but we're a national organization. And we have partnerships all across the United States with health departments, and Kansas has partnered with us for a couple of years. And it's because of this partnership that I can bring trainings like this to you and your team. You get the free materials, you get all the great resources that we've partnered with them on. And so I'm excited to talk about the importance of tracking fetal movement in the third trimester to prevent preventable stillbirths with you all today. Before I kind of dive in to a little bit more about Count the Kicks in general and how to implement it, I do like to do a shout out. Kansas, the MCH program is amazing, and there's a lot of awesome resources out there for you all to access. They have this maternal warning signs toolkit that talks through a variety of different things. It's a state-led initiative launched in 2021, July 2021. And it's really in response to the data and the findings and recommendations from the Kansas Maternal Mortality Review Committee. Its goal is to educate providers and perinatal persons, family and support persons about the urgent maternal warning signs to leading to decreased fetal movement, mortality rates, etc. And so this is a free resource that you can access. I'll put the link in the chat or the email that goes out so you can always access that at any time. Obviously, this is me. I'm Megan Ockett. I'm the program director with Healthy Birthday, which is actually the nonprofit organization that created Count the Kicks. So think of Healthy Birthday as the umbrella, and Count the Kicks is the handle holding up the umbrella. Count the Kicks is our evidence-based stillbirth prevention program that I'm here to talk to you about today. My background is in public health. I am passionate about maternal and child health. I have 3 kiddos of my own. I use the app with my last, who was born in 2018. The others were before the app, and I have a passion and background in systems level change, integration. How can we make things easier for you? How can you integrate this into your workflow, things that you're already doing, so this becomes second nature? That's my goal today, is to get you comfortable talking about stillbirth and stillbirth prevention and show you how important it is and why it's so important to talk about and how easy it is and how we should all be doing this. Feel free to contact me at any time. My email address is there on the screen. I love hearing from people within the community. You are the boots on the ground, the grassroots. You're taking this and sharing it with your expectant parents and your families. So it's because of you that we are successful in saving babies and mamas from preventable stillbirths. Before I dive in, I like to preface the whole presentation with this video. This video is about Baby Save Ruby, and you'll hear me say Baby Saves a little bit throughout the presentation. And what I mean by that, when I talk about a baby save, is that means a mom or a dad or somebody contacted us and said, hey, I was using your app, or I was told by a home visitor about this. I noticed reduced fetal movement. I spoke up to my provider, found out baby needed to be born, and they're here because of it. So thank you. So we call those our baby saves. I'll talk a little bit more about those. You have a couple in Kansas yourself that we know about. We know there's a lot more out there. These are just the ones that have reached out and contacted us directly. So you never know when this information is going to stick, when this is going to connect with somebody. We know that mom to mom storytelling is so important. So anytime you have an opportunity to share one of our videos, to share this Good Morning America video, to go to our YouTube page, this is what you're going to remember. This is what your families are going to remember. You're going to remember baby Ruby and baby Eva today, because those are the two videos I'm going to share you. They're baby safe stories. And this makes an impact. When this aired on Good Morning America in 2017, we saw a huge, like a 130% spike in our app downloads. So anytime we have the opportunity to share these on the statewide level, PR, with your expectant parents, do so. This does a good job of showing you how the campaign works. It does a good job of showing you of how the app works if you're not familiar with it. And it's just a feel-good video. It's about a mom advocating and speaking up for herself. And now baby Ruby's a big sister. She's, a couple years older, 4 or 5. And so let's go ahead and watch this video.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
I love that little baby stretch at the end. So that's baby Ruby's story. Before we go further, let's just make sure we're all on the same page with terminology to level set. Knowing with the chat where you all work, I think we're all on the same page, but just in case, I want to make sure we all know that today we're obviously talking about stillbirth. Stillbirth is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. You can see those definitions there. And then there's miscarriage, which is usually defined as loss of a baby before the 20th week of pregnancy. And then there's infant mortality, where I think infant mortality tends to be the one that gets the most confused with stillbirth. But infant mortality is actually death of an infant before his or her first birthday. And what I want you to take away from this slide is the fact that on average, we're losing around 23,500 babies every year to stillbirth. And on average, we're losing around 22,000 infants for infant mortality. So we're losing just as many babies to stillbirth as we are to infant mortality, but we're not talking about it. We're not talking about stillbirth like we talk about infant mortality. And that is not by any means, shape, or form to underscore the impact and devastation and tragedy that infant mortality is and has on a family and a community, but it's to show you that we should be talking about stillbirth just as much as we're talking about SIDS prevention, back to sleep, so we can decrease those rates, because if we don't talk about it, nothing will change. And so today you're going to get the tools and resources of how to talk about stillbirth and how you can be part of that change to decrease that number from 23,500 babies every year. Diving in a little bit more, when we look at that 23,500 babies that are stillborn every year in the United States, what that means is that 1 in every 169 pregnancies nationally ends in stillbirth. And the racial disparities are large. For Black women, it's 1 in every 96 pregnancies. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over their white counterpart. For Hispanic moms, it's 1 in 199, Indigenous, 1 in 138, white women, 1 in 204, Asian Pacific Islanders, 1 in every 233 pregnancies. Again, it's just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. We lose around 65 babies a day to stillbirth. That is equivalent to a kindergarten class or a busload of children. If that happened and we lost a busload of children every single day, that would be all over the news, and we would all be ready to go to our legislators and, public health officials to say we have to do something. So that's what we're doing. We're speaking up, we're empowering our expectant parents on doing something and how to advocate for themselves and their baby. And so if we look at your data specifically in Kansas, you have around 279 fetal deaths per year. So your 5-year average, if we think back to that rate, you are at 5.44 fetal deaths per 1,000 births. In 2018, we worked with the Kansas Department of Health and Environment and MCH to launch Count the Kicks. And so you can see the rate went down in 2018 to 2020. That's the most recent we have on record, from 5.4 to 4.9. So that's really exciting, right? And that's in partnership with all the other great work that the Kansas Department of Health is doing for maternal health and birth outcomes. So we're part of that. We're a true partnership. So we went from 284 fetal deaths to 169 fetal deaths, which is amazing, but our work's not done, right? We want to get down as close as possible to 0. We know that not all stillbirths are preventable, but the majority are. And so what we want to do is get me out of a job, right? Like that's our goal. In 2020, I do have some race data for you. This comes from the Kansas Department of Health and Environment Division. Per 1,000 live births plus stillbirths, the rate was 3.4 for white non-Hispanic, and then 10 for Black non-Hispanics. That's 10 stillbirths for every 1,000 births. So you can see that's more than double for the white rate, which we just talked about, and 6.8 for Hispanics. So, we have some work to do, right? We want to work within marginalized communities, and we'll talk about how we can do that together here in just a second. So what we want to do with Iowa or Kansas is what we've done in Iowa. So we actually launched in 2008. We had a soft launch, and I'll talk a little bit more about that later. But from 2008 to 2018 and then beyond, we've had a 32% reduction in the number of stillbirths. And that's what we want to see happen in Kansas. So you can see that downward trend, that dash line. We want that to happen in Kansas. And we're already doing that, right? We've already seen that slight trend go down. And that's exactly why we're talking today, because you're going to make that go down even further. And so there's a couple outliers in there. You can see like 2017 and 2019, things like a syphilis outbreak, which I know Missouri is having right now in southern Missouri. And Michigan, I think, is having a syphilis outbreak, things like a pandemic. So there's some things obviously outside of our control that could impact stillbirth rate. So that's why it's even more important now than ever when we're in kind of, I guess, the end of a pandemic, maybe a middle of it. I'm not really sure where we're at with that, but those things make a difference. So as much as we can advocate and share this with our expectant parents, that's going to help decrease and get to our stillbirth rate reductions. The African-American stillbirth rate in Iowa decreased nearly 39% in the first 5 years of the program. This is what we want to see happen in Kansas. So let's talk for a moment about why there are such large disparities for stillbirth. Why is this happening? And I think it's not surprising to anybody. And I think it's so important that we talk about and we address it. So things like systemic racism in healthcare settings, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and everything that comes with it. We also use the term weathering. That's what weathering is called too. It has led to real and pervasive health issues for Black women. Epigenetics, predisposition to certain conditions, access to healthcare, socioeconomic barriers. But research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So what can we do about it? What is Count the Kicks doing? What can you do about reducing these disparities that exist and persist in stillbirth? Well, a couple of things that we're doing and you could look at is, what are your languages in? Do you have, your outreach in multiple languages? Are you meeting the needs of your community? So we have the app in 14 languages, and we'll talk about what those languages are in a minute. But if you serve a demographic that you don't see the language for on our app, let me know, because we want to make sure we're being inclusive and meeting your needs and meeting your community. So we will get that figured out and added if we need to. We have culturally appropriate educational materials. We have videos, printed educational materials, and FAQs in multiple languages. We now have not just a health equity director who we just hired, a brand new position, but a health equity coordinator. So we're building that equity team. People on our team that have lived experiences, training, and DEI, and that they're looking at all of our materials and ensuring that we're culturally representative, culturally competent, and helping us move the dial on this. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We improve programming based on lived experiences shared by people of color, community conversations, focus groups, surveys. We're working within communities considered to be marginalized, and we're working outside typical healthcare settings. For just a couple of the things that we're doing that you might be able to implement as well. So let's dive into more about the research and evidence behind this campaign. So some of my top questions that I get are, how is this evidence-based? And show me the research, and I'd be glad to do so. We have a whole page on our website called Evidence, and that's where you'll find several different journal articles and research articles on the importance of fetal movement monitoring. But the one I really want to highlight today is the one you see on your screen. And I want to highlight this one in particular because this is the research study that started it all. This study out of Norway showed when women were educated on counting their baby's movements in the third trimester of pregnancy, that among this cohort of women, the stillbirth rate decreased nearly 30%. And so what happened was, long story short, we were founded by 5 Central Iowa women. They heard about this study when they were at a conference, and they said, that's amazing. 30% is amazing. We can do that. If we can just save one baby, it'll be worth it. Let's come back to Iowa from this public health conference. Let's work with other researchers and IDPH, Iowa Department of Public Health, and create an empowering, uplifting campaign that educates expectant parents on the importance of tracking fetal movement. So they came back to Iowa. That's exactly what they did, using this research as a catalyst to create what you all know as Count the Kicks today. And so Dr. Ruth Bretz here cited, she was the only US researcher on this Norway study. And she's also now part of our medical advisory board. She's in Harvard Medical School, OBGYN. She stated that tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. Amazing, wonderful. And then the other research that I wanted to show you, and the other top question I get is, well, Megan, this is just going to increase anxiety. I'm going to have all these patients and all these parents say, I don't want to do this. I'm going to be anxious. And I promise you that does not happen. Kick counting does not increase anxiety in most pregnant women. This study found that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to the pregnant woman and prevents unnecessary visits. Because if you think about it, what you have now is somebody that understands their baby's normal movement pattern and understands when to speak up if something changes. And with the app, especially now, they have data in their hands to go to their provider and say, look, this is not my baby's normal. My baby's normal is X, Y, and Z. And this app is showing me that this is not normal. I want to be checked out. I want to be seen. We have done our own study on our app users through the Des Moines University and the Harkin Institute, and preliminary findings have found that 84% of our app users stated that regular tracking was associated with feelings of bonding. They could include, siblings, significant others. It's a time to focus on baby and baby only. And that 77% of our app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And then there's added benefits that I don't think people always considered that fetal movement monitoring has. I think there's a misconception out there that you have somebody come in with a change in fetal movement and it's an automatic C-section. And I think we need to, we can't think like that. What we need to consider and understand is that monitoring baby's movements is a way to check on baby. It's a way that a baby communicates with the expectant parent. So if there is a change, the provider, the clinical team will do additional testing. It's not just come in and deliver. It's let's go through a protocol pathway of what other testing we need to be done to see how baby and mom are doing. So there's added benefits. There's a reduction of preterm birth rate. If we can identify fetal growth restrictions earlier because something happens and there's a change in movement, that could, say maybe we have a small placenta, maybe we have, baby's not growing like they should be. What can we do now to make sure that we can get that baby as close to 40 weeks as possible? We also know that women who have stillbirths are substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. Women are 4 times more likely to die if they have a stillbirth. So not only do we have an option and chance to prevent preventable stillbirths and save babies, but we also could very well be preventing maternal mortality and saving mom's life from hemorrhages, blood loss, everything like that. So this researcher states that due to the low cost, it's non-invasive, and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So I just briefly talked about that connection between stillbirth and maternal mortality and morbidity. And one of the things that, if you've been on one of these presentations before, this is probably new to you, but we just released, well, not just, but in April, we released a white paper. We had researchers from the Harkin Institute look through lit reviews, interview firsthand accounts from American women who almost lost their lives, or Count the Kicks helped notify them and their provider that something was going on and it saved their lives on this connection. So you can scan this QR code, or I will definitely send it out in the email, but there is that connection. So I highly recommend you read this, you share it with your team, anybody else that would be interested. Okay, we have the data, we have the research, we have all of that. We're ready to talk about implementation. Just a quick overview. Obviously, this is a stillbirth prevention public health campaign. It is evidence-based. We are educating birthing people on the importance of tracking fetal movement through the use of our mobile app, which we'll talk about in a second, or we also have paper kit counting charts available for your use as well. And what I love most about this is it's empowering. If we think about stillbirth and how tragic it is, we know that it's very hard to talk about. And so what the founders who all experienced stillbirth or infant loss, what they wanted to do and ensure was that they created a campaign that was uplifting, it was bright, it was colorful, it was empowering, not to scare people, but to educate people. And that's exactly what they did with the material. So it's empowering people to speak up to providers if there's a concern. So why is this so important? Because movement is one very important way a baby communicates before birth. A change in a baby's movements can be an early sign and sometimes the only warning sign that a baby may give when in distress. So a baby during pregnancy is just like you and me. When you and I are sick, we're sitting on the couch, we're resting, we're laying down, we're not at our normal level of energy, we're not chugging Mountain Dews, trying to get through the day, we're sick, we slow down. Same with baby in utero. If something's going on with baby, whether it's low amniotic fluid, cord issues, infection, whatever it is, their movements might change. They become weaker during that time of distress. They're preserving that blood flow to vital organs such as the brain and the heart to conserve energy and self-protect. That is why this is so important. There's 3 types of movement changes I want you to be aware of, and this is something that you might not have seen before. So the first one is obvious. The baby has fewer or no movements, they slow down. But we also want to pay attention to the strength of those movements. Maybe they move, but their movements are softer or weaker, similar to what baby Ruby's mom said in that video. We have a new feature on our app that I'll talk about that can help measure the strength of those movements. And then a newer one is that sudden wild surge of movement can also be an important sign of distress. And what I'm talking about and what research points to and people that we've talked to anecdotally is they explain it as it's almost like a violent surge of movement. It's not like a baby roll that hurt a little bit. It's a violent, wild surge, frantic movement. The important takeaway here and in general is if mom, expectant parent notices any sort of change in movement, they need to speak up. That's not normal. They need to speak up to their provider. If it's not their baby's normal, they need to speak up. So what I want you to do is to start having this conversation with the expectant parents you serve around 28 weeks or the 3rd trimester. I know we have some home visitors on the call. If you do not see people on a regular basis, like maybe you see them once a month or you see them 2 times a month or every other month or something like that, it is okay to talk to them about this if they're 20 weeks pregnant, but just let them know you want them to start counting at the 3rd trimester. So introducing it, if you're not going to see them for 10 weeks, absolutely do that. Please do that. And encourage them and say, hey, make sure you talk to your provider about this the next time you see them. If you do see them more regularly, absolutely, you're going to see them at the 3rd trimester. Talk to them then about it. 26 weeks if they're considered high risk and you know they're high risk. The reason that we do this around the 3rd trimester is because that's what research has said, that babies really get into that consistent pattern that we can track and we can monitor. And so when we talk about Count the Kicks and we talk about fetal movement monitoring, what does that mean? What do you count? That's one of the top questions I get when I do parent presentations. And what we mean by that and what you can explain to your parents is that it's any movement. It's a roll, it's a kick, it's a jab, it's a push, anything except hiccups, because those are involuntary and they don't count. And hiccups, if you've ever been pregnant and you've felt a baby hiccup, it's a very specific movement that happens pretty quickly and continually for a amount of time. And so you can kind of explain that to, especially your first time expectant parents that might question if it's a hiccup or not. So how do we do this? So this is what you're going to share with your expectant parents when you're talking to them. You're going to say, hey, I'm so happy to hear you're in your 3rd trimester. Now is a great time to start counting your baby's movements. This is how you do it. I want you to download this app if they have access to a smartphone and Wi-Fi, reliable Wi-Fi. If not, there's these kick counting charts on our website that you can download, but we want them to download the app or use the charts, and I want you to count daily. I cannot stress this enough. You want to encourage them to count daily, preferably around the same time, because that is how they're going to understand and start to see that pattern. We have heard that people will count when they think they have a change in movement, or they count every other day. Those are not good times to count. We want them to count daily so they can get to know what's normal for their baby. They can't do that unless they do it daily around the same time each day. So they're choosing that time. Maybe they know baby's usually active around 3 o'clock in the afternoon. So they're going to sit down, they're going to focus on baby, and they're going to time how long it takes baby to get to 10 movements. They can use the app or they can use the paper charts with the clock. After a few days, they will begin to see a pattern for their baby. The average amount of time it takes baby to get to 10 movements. Maybe baby gets 10 movements in 15 minutes, 15, 20 minutes every, for the last 3 weeks. And then all of a sudden baby got 10 movements in an hour and 15 minutes. That's a significant change. My baby's been getting 15 or 10 movements in 15 minutes for the last 3 weeks. And now all of a sudden it's taking an hour and 15 minutes. That's a change where I'm going to contact my provider. I'm going to work with my care team and see what they want me to do. Again, continue tracking every day, calling their provider right away, encourage your parents to know which number to call. Even if it's after hours, they should call. If you are their nurse, if you're a medical person on this call today, we have talked to expectant parents and we know how much it means to them to say, call me. I am here for you. That is my job. I want to make sure you're not anxious, that you're feeling okay. Okay. If you have any questions, call me. And then they work with their care team on next steps. So now what I want you to do is to pull out your phone if you haven't already done this, and I want you to go into your app store right now as I'm talking, and I want you to search for Count the Kicks and find the little yellow clock icon, and I want you to download the app. And I want you to do this because I want you to use it. I want you to see how easy it is to use. So when you're talking about it with your expectant parents or you're in a childbirth ed class, you can ask them to take out their phones. I want you to say, look how easy this is. I am pretending I'm pregnant. I have like 8 pregnancy profiles in there. And I can show you my data. I can show you how to start a session. I can show you how to download the session. So how it works is when they download the app, we recommend they register and they fill out all that information. It's just kind of demographic information. But what they do is they hit that big red button that says start counting. And you see that little image there with the foot icon. When they're ready and they feel that first movement that they want to start with, they're going to tap that footprint with that movement and a timer will start. So every time they feel a movement, they tap that footprint again and again and again until they get to 10. When they get to 10, the timer stops automatically. And what the app will do, it will just show them this graph that you see, a line graph that will show them after a couple sessions, you can see, they'll be able to see how long it takes baby to get to 10 movements. So this baby in particular takes around 15 minutes and 24 seconds. So you can see some days it took 16 minutes, sometimes it took 17 minutes to get to 10 movements. This baby's normal average time, I would say, is around 15, 16 minutes. So if one day I was counting and this was my baby, and all of a sudden it took, like I said, an hour and 15 minutes. What happens to that graph is it increases, it shoots up. There's a line that shoots up that indicates to me as a user to say, that's not my baby's normal. My baby's normal is around 15, 16, 17, 20 minutes. And now all of a sudden it took over an hour and the line shot up. I'm going to call my provider and see what they want me to do. That's it. That's how simple it is to use. So a couple other features that I wanted to highlight was within the app itself, you can set a daily reminder to count the kicks. So they don't have to go out and set up something in their own calendar. They can just do this right away in the app. And then they get those push notifications, things like, oh, it's time to count your little kicker, just nice reminders. They can review their kick counting history. They can download it and share it with their providers, with their friends, with their significant others. This is a great opportunity to reach out to their provider and say, hey, have you heard about this? Like empowering them to do that. You can count for single babies or twins. You can track future pregnancies on the same profile. You can manage multiple devices registered to your account. So I could be counting on my watch, my Apple Watch, and one day and the phone the next day. And soon we're going to have a web counter. So people who, they could go to the library and count, or a friend's house, or maybe they can't use their phone at work, but they can do something online. They could use the web counter that way. So look for that information to come out soon within the next month or two. So the other thing that I wanted to stress with the app was our strength tracking. And this is how we can monitor how strong baby's movements have been, like I talked about earlier. And so one of the things to think through is when you're counting, we're also feeling how strong those movements are, right? So after I get done tapping that footprint and I got my 10 movements, what happens is the screen shows up where it says almost done. Please fill out the following fields to finalize your kick session. So what we want people to do is to rate the strength of those movements between 1 and 5. Basically, they can fill in those little feet based off the strength. 1 being very fluttery, where the movements are very light. I would equate that to movements early on, 20, 21 weeks when you first start feeling those movements, all the way to fierce, which could be you're strong, you feel like limbs are poking out. And then there's a notes function as well that they can put like a little mini diary if they want to remember things. This can all be downloaded and shared with their provider. So then what happens with the movement strength is users get a bar graph. Whereas remember the movement or how long it takes gets a line graph. So they're two separate things, but it's very visual. So now what they can do is they can see baby's strength and they can see it in a visual way. So that the important thing to know here is really if that strength changes, let's say it decreases, it's normally a 4 or 5 and all of a sudden it turned into a 2 or 3. I need to call my provider and see what they want me to do. So that final screen before they say click on finish session shows the line graph of the movements and the bar graph for the strength. So again, very visual. This is just an example. You can see the top graph is the movement. So you can see it probably took significantly longer. The line graph shot up and my movement strength decreased. I am not saying that these have to coincide at all. What I'm saying is that it's very visual. You could have the same amount of movement, but your strength decreases. I would still call my provider. You could have the same amount of strength, but the movement takes significantly longer. I would still call my provider. The intention of this and this whole app and this whole program is to empower them to understand what's normal for their baby and to speak up if they have a change. So the other cool new feature that you all have in Kansas in particular is what we call our social determinants of health survey. So this is just for people in Kansas to use on the app. And what happens is after somebody's second kick session in Kansas, and it's all tied to zip code, that's how we know how we connect it, is they will be asked this. They will say, nice work. We want to make sure you are feeling your best and have all the resources and help you need. Before closing, please take a moment to answer the following questions regarding how you're feeling at this time in your pregnancy. They can skip it or they can go next. It's completely voluntary. If they decide to move forward with these questions, there's only about 4 of them and they're yes or no questions, very simple and easy. They're all geared towards, do they know how to access resources? Can they find the resources that they need? Do they need help? And it says, if you answered no to any of these questions, call 1-800-CHILDREN can connect you to these resources in your area. So what they can do in the app itself is actually call out of it right away to 1-800-CHILDREN if they want. If they don't want to, they just hit, finish, and they can go to that Find Support tab, which again is on the resources section of your app because you all logged in right now and you registered. It's tied to your zip code. So anybody in Kansas is going to see that Find Support, that no question is too big or too small when it comes to parenting, et cetera, and they can call out of the app. So that's a really cool new feature that we just implemented this last couple of months. And then what happens is the state can get data on this and say, okay, I see a lot of people answering no, what else do we need to do to make sure that we're connecting people with resources? How else can we do this? Here's one way. We also have a free resource on the app called Find Help. So people can go to it in the resources section, and this is national. You just enter your zip code and you can find free or reduced cost resources in your area. So people could search for food banks, they could search for housing assistance and diaper banks. And then what we can do is we can look at that data and go to Kansas Public Health and say, you have thousands of people searching for diaper banks, for example. How can we help promote diaper banks in the state so that people know how to access them and get resources? So it's just another way we're trying to connect the dots prenatally for people so the chance of that baby experiencing adverse childhood experiences decreases. That is our goal. We have this audience that's already using the app, so why not connect them to resources they may need prenatally versus after baby's here, you have a crying newborn, your milk is coming in, you're in pain, and you're trying to figure out these important needs, necessities. So I'm just going to play this video. This is also on our app, but this is the app in real time. This is how you use it. So you can see it happening in real time. And I will say, she says that the app is in 12 languages because we shot this video right before we increased the app to a couple more languages. And I will say we are adding Portuguese this year and Hebrew. So it will have even more languages here in the next couple months. So let's go ahead and watch this in action. And this is something that you can share with your moms or expectant parents.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
All right, so you downloaded the app, you know how to use it, you've been practicing, you're multitasking, you're listening to me. How do we talk about this? How do we talk about stillbirth and Count the Kicks with your expectant parents? One thing before we dive into that is to know that this conversation that you're having with your parents improves their health literacy. And we know that health literacy is one of the strongest indicators of an individual's health status. So things to keep in mind and think through when you're doing this is that we want to be equitable. We're avoiding assumptions and we're providing this information to all expectant parents, no matter their race, gender, religion, socioeconomic status, sexual orientation, marital status, or educational level. It's the same information and same interaction every single time. You're listening and learning. You're asking strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. You're being clear and concise. You're avoiding long or complex explanations. It's not like you're going to go in and you're going to say fetal movement monitoring. That's what I'm doing today with you all because we all know that. But with parents, you're going to talk about kick counting and baby kicks and baby movements. So consider everyday vocabulary. And then you're going to be honest, right? We're going to speak truth while still practicing empathy and compassion. This is a hard topic. This is something, though, that we all need to be aware of. And I'll talk about this on the next slide, but we talk to pregnant women about all sorts of things during pregnancy. And this is something else that we should be and need to be talking about. Reteach. If the patient displays confusion or a lack of understanding, make sure to correct and clarify, provide extra support to those who need it. One way to do that is what I encourage, and I hope that you do, is every time you see your expectant parent, whether you're seeing them every other week, once a month, however often you see them, that you are talking about this every single time you see them if it's in the 3rd trimester. That repetition is key. So make sure you're doing that every single time. And this is all going to improve their own health literacy. So how do we do this? You don't want to scare anybody. And again, what I just said, pregnancy is full of risks that we talk to people about. Stillbirth is another risk that expectant parents deserve to be educated on. Just like we talk about not drinking because of fetal infant alcohol syndrome, taking your prenatal vitamin, blood tests, and all the different tests that we have to go through and why. Why aren't we talking about this? If there is a way that could potentially prevent this from happening, they have a right to know. Stillbirth just happens. There's nothing we can do. There are warning signs if moms know what to look for, but how are they going to know what to look for if nobody tells them, right? If they don't see a brochure, if they don't have somebody talk to them about this? Anybody can talk to them about this. I have been in line with people who I know clearly are pregnant, and I'll say, hey, have you heard about Count the Kicks? I mean, I do it because I live and breathe it every day, but you can do this. You can talk about this. And it's simple as saying things like that. Have you heard about this? Let's talk about this. You're going to get this one a lot. My baby's always active. I don't need to do this. I get it. I got it from all my friends when I told them what I did and they were pregnant. And I said, make sure you download the app. Make sure you do it daily. And they'll say, oh, it's like a jungle gym in there. And I get it, right? I've had 3 pregnancies. I understand. 2 of mine were very, very active. 5 minutes or less, I'd get 10 movements. But it's just what I always say to those individuals. That I always say, that's awesome. A healthy baby is an active baby, but it's still really important to know if your normally active baby has slowed down, because cord and placental accidents can be sudden, and you need to know what's normal for your baby so you can notice a change and takes the guesswork out of knowing that. She's almost at her due date. The risk of stillbirth increases, and it increases significantly as mom approaches or exceeds her due date. That's kind of an old wives' tale, right? Like you think you're closer to the end and you're like, oh, nothing will happen now. Like I've gotten through all the scary times. But no, that's a myth. Like you can have a stillbirth at any point in your 3rd trimester, and it increases significantly. So what about people who have already had a stillbirth, and how do you talk to them about fetal movement monitoring? You're going to follow the same protocol. However, because somebody who's had a stillbirth already, they're more likely to experience another stillbirth. So we want to start talking about this at 26 weeks versus 28 weeks. And if you found out, or you just find out about their previous stillbirth, be sure to acknowledge that child. Ask the name, ask the gender, read the chart if you're a new medical provider for them. They want to talk about it. Stay away from medical terms like fetal demise. Ask them, has anybody ever talked to you about the importance of tracking fetal movement before? A lot of the women that we've talked to that have experienced this tragedy and this loss have said, I have 2 healthy, wonderful children, and I had a stillbirth and nobody told me. I knew I felt reduced fetal movement, something was off, but I had no idea that I should have contacted my provider. So we need to be talking about this to everybody. Some other common myths, here's that active one. I stress it a lot because I think you're going to get it a lot. Again, tracking your baby's movements every day takes the guesswork out of knowing if your normally active baby has slowed down. Those experiencing high-risk pregnancy should pay attention to their baby's movements. That's false. Again, we want all expectant parents to be educated on Count the Kicks and get to know what's normal for their baby. 10 and 2, I guarantee you have all heard this, or you have said it before. Baby should get 10 kicks in 2 hours, or you get a call and you say, call me back if you don't get 10 kicks in 1 hour, I've heard. And so what I want to say here is that every baby's different, and the recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements around that same time period. And the reason for this, and there's this research study on our evidence page, but basically what it says is, as humans, we focus on that time so much. So right now I have you for another 10-ish minutes, right? This ends at 1. And so when we hear that 10 and 2 as an expectant parent, what we hear is, okay, I've been counting for the last 3 weeks and it's been about 20 minutes. I get baby's movements, 10 movements in, and one day I count and it's an hour and 47 minutes. But I think to myself, well, that's totally okay, because I've heard, and my provider said, I should get 10 kicks in 2 hours. So I'm fine, but that's not my baby's normal, right? For the last 3 weeks, I've been counting and it's taken 20 minutes, not an hour and 47 minutes. And so that's a significant change. I want to call my provider and work with them to see what they want me to do. What about a Doppler device? I know there's apps out there. I can just download an app and find my baby's heartbeat, right? I think a lot of people don't know that a change of baby's heartbeat is one of the last things to occur when a baby's in distress, whereas a change in baby's movements may indicate potential problems before actual changes in the heart are detected. Expectant parents should only use a Doppler device under the guidance of a healthcare provider, not to mention the fact that it's hard to find. You might find your own heartbeat versus the baby's heartbeat. When you do go into like labor and delivery, or if you have reduced fetal movement and you go in and get checked out, your medical care team, they should not only be doing a Doppler, right? They're doing additional tests than just that heartbeat. And this is why. The baby's not moving, I should drink cold water, I should drink Mountain Dew, I've heard I should do jumping jacks. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice or candy. If a baby's not moving like normal, parents should speak up to their provider right away. Again, when you and I are sick, we're not chugging Mountain Dew to get moving, we're resting. Same with baby in utero. Why are we trying to force baby to move if they're not moving like normal? So let's move away from that. Old wives' tale, babies kick less near the end of pregnancy. If they don't run out of room, the type of movements may change. So it's more of those jabs, less of those fewer body rolls. But again, we all know this, you all know this today. Babies move up to and during labor, right? They're moving through the canal. If an expectant parent is monitoring their baby's movements the same time each day, it should still take about the same amount of time to feel those 10 movements. People should avoid dental care. I think this is a common misconception. Obviously you can't get x-rays, but let your dentist know that you're pregnant. But it's still very, very important to have good oral health hygiene, especially during pregnancy. There's a lot of connections there between birth outcomes and good oral health. So let's make sure we're encouraging people to go to their dentist. If I have any labor and delivery triage nurses on here, like hats off to you, you're amazing. Make sure you order this material because this is the perfect place to have Count the Kicks information. We have discharge instructions, everything like that you can order as well. So other ways to integrate, I'm not going to dive into it too much today, but if you have more questions or you want me to come in and talk to you about your workflow, if you're a home visitor or an NFP and you have family or WIC, you have family care plans, you have intakes forms, can you ask a question? How many weeks pregnant are you? And mark that down and then put a flag if you need to talk to them in 10 weeks when they get to their third trimester, or you need to set reminders to talk to them every day when you see them after that. If you're a clinic and you're a clinic setting, can you have them download the app when they're doing the glucose test and they're drinking that lovely sugary drink and they're waiting in the waiting room to get their labs drawn? Could you have them download the app? Can you integrate this into your EMR, EHR? We have gold standard discharge instructions for your labor and delivery. I went to triage 3 times with my daughter to get checked out. Everything checked out fine. That would have been the perfect opportunity to also have Count the Kicks information in my discharge papers. So feel free to reach out. So finally, just wrapping up with a couple things. This is my favorite part, and I'm not sure we have time today, but if you go, we're multitasking again, go to countthekicks.org, and I put that in the chat earlier, or you can scan the QR code. Normally what I do is I play this fun song by Pharrell Williams, Happy, and I say, go right now and order materials. One, because you'll be entered to win for a chance to win a gift card. So if you go right now and you order materials, I will pull that report and I will do a drawing for another Amazon gift card. So go ahead and do that now. But while you're doing that, keep listening to me. So I'm not going to play the song. I'm going to keep talking so we can end on time. Because of this great partnership with Kansas, we have promo posters in English and Spanish. How-to posters is what you see big on the screen. App reminder cards, English and Spanish brochures, and it's all free. Shipping is free. The materials are free. We have magnets. You have wristbands. Wristbands are great and should be utilized if you work in areas where the parents you see don't always have broadband. They don't have Wi-Fi access that they need to count with a pen and paper. Order the wristbands for them. So go ahead. I'll give you a couple of minutes as I'm talking as we wrap up to go order that material, and then I'll pull that report and one of you will have another chance to win a gift card. And then we have an online CE training. You can take this training. It's 2.2 CEs. I will send this out to you also. You don't need to take a screenshot or anything like this, but there's a coupon code. You can take this training for free. So feel free to do that. It's an extended version of what I did today, but it has a lot more about a whole module on equity. Other free resources, go to our website. We have parent academies, suites, you know, full of great videos and information. And we have childbirth ed lesson plans, multiple languages, things like that. And then we also have our wonderful ambassadors, our feet, boots on the ground. They can help do presentations like this. They can do in-person things. So if you have a baby fair coming up or events that you want somebody there in person, as much as I would love to hop in a car and travel to you all, we do have people that are a little bit closer that are trained volunteers. A lot of them are lost moms, some are baby save moms, but this is their passion. And it's because of them that we are able to have this national lens and hold that we can connect with you. So feel free to reach out to me if you have events coming up. And then why do we do this? We do this because we want to save more babies like Eva. This is a Kansas baby, Eva, who was saved a couple years ago. So we're going to go ahead and watch her story and then we'll wrap up.
I feel like it's what saved my baby. It was at my doctor's appointment. I think I was about 28 weeks when they gave me a brochure from over there. That's when I downloaded the app. And then it became a part of like bonding time because I would like set aside an hour every day and then count the movement. Another thing is that it tracked all the data, so it was a way to know exactly how long it took. It was interesting to actually see how long it took because the app, you can tell how long it takes, and then you can just tap it. It was pretty easy to use. Towards the end of my 36th week, it started taking longer than it usually did. I didn't want to go to the hospital if I didn't have to. And then they found out I actually didn't have any, like I was really low fluids. It could have been a different outcome altogether. My provider was listening. They took my concern pretty seriously, so that helped too. So I encourage them to speak up because their baby lives might depend on it. The app just tracks the time, so it's pretty easy and it's free to download. So yeah, I definitely encourage other people to download the app. Right now she sleeps a lot, she eats a lot, but she's a happy baby. I'm really grateful that I found out about Count the Kick from my doctors.
So that's baby Eva for you. And like I said, she's Kansas. So next steps, you're going to become familiar with the app, which you already did. You downloaded it. You ordered materials, which you did because we're all multitaskers. I get it. That's awesome. This takes 3 to 5 minutes. This is not a long process to talk about with your patients, with your clients. So please do this every time you see them in the 3rd trimester. Make sure everybody knows about this. This is being recorded. I'll send out the recording to you all. So make sure to share it. Talk to me about integrating this into your EMR, EHRs, if you want the discharge instructions, the gold standard that we have. And remember, hours and minutes matter. So if you work in a very rural area where there's a 60-minute drive to the nearest birthing center, people cannot wait for their clinic to open the next day. They need to get going and get checked out. So making sure that people know that as well. And then, of course, connect with us, follow us, reshare all of our posts, sign up for our newsletter. Oops, 2 slides in there, but here's my contact information. We have a couple minutes. I'm happy to stay on and answer any questions that you may have. I'll check the chat, but it looks like all of you were just putting your names and contact information or organizations. So I really do appreciate all that you do. And thank you so much for giving me an hour of your busy schedule and your time today. It's because of you that we're going to save babies in Kansas. So thank you and have a great day. Thanks, everybody. Stay on for just a minute or two. Thanks, Erin. Dakota. Oh, I almost went live on Facebook. We don't want to do that, do we?